So, and about this H. pylori, can you add a little more how you want to add anything about H. pylori?
Yeah. So, whenever you have symptoms of peptic ulcer disease, as I mentioned before, whenever you have pain that is related to food, and these pains have certain specific characters like not radiating and all, and if it is for a certain duration of time, it is better to consult your doctor.
Best.
And if at all you think a patient is having peptic ulcer disease, the first thing you have to do is get an endoscopy done, upper GI endoscopy.
Okay.
Why? Because unless you do endoscopy, you cannot identify what the problem is. That it can be in the stomach, it can be in the initial portion of small intestine, duodenum, and then you should think why this ulcer came to me. If I am having H. pylori infection, that can be confirmed only on endoscopy. There are some other non-invasive tests also there, but they are quite costly for our Indian scenarios.
Okay.
So these are very just you do an endoscopy, take a bit of tissue from there and put it into the kit. The next moment you will get the result within 1 minute, and it's also almost the sensitivity of these kits are also currently good, and it's very cheap also. And once you identify this H. pylori, and you should target about eradication of H. pylori. And right now all we have to understand is that the treatment of a peptic ulcer disease, it's been fixed in our mind that antacids are the treatment of our peptic ulcer disease. It is not so.
Very important.
In addition to antacids, this H. pylori eradication is going to be the treatment of H. pylori. In fact, H. pylori needs antibiotics for 14 days. In addition to this antacid, this H. pylori eradication has to be done. Unless you eradicate this H. pylori, you are going to suffer from this peptic ulcer disease for years together.
It's going to become from mild to moderate, moderate to severe. And when people present at a very severe stage, then we are also helpless to do anything. So very, very important, guys, when you start having this symptoms of burning sensation itself, please approach a gastroenterologist. And about this endoscopy, see, if you put your finger into the mouth itself, you feel you have that gag reflex, you want to vomit. So how comfortable is it, sir?
No,
how do you make it comfortable?
Thing is that we have local anesthetic sprays.
Okay.
Once you spray over the oropharynx and oropharynx, mostly you will not get this gag reflex.
Gag reflex is gone.
Mostly it will not be there. It's
very, very less, minimal, very
less.
minimal.
And moreover, it's just 5 minutes procedure, and you will not be that uncomfortable. It's an outpatient procedure, and it's not that uncomfortable.
Okay. Just a layman's question. When you're taking a bit of pinch of that this thing in that endoscopy itself, there is an equipment to do that. That is not going to be painful, harmful.
No pain will be there.
Okay, no pain,
no pain.
Okay, so these are some of the things. If you have any questions on the topics which we have discussed on H. pylori, on peptic ulcer, on the prebiotic and probiotic, put it on your comments below. Hit the like button and subscribe button. Send it to your friends and family. Thanks a lot, guys. H2O, Dr. Sashi and Dr. Puversen. Vanakkam.